Morning, everyone. Look, before I start, obviously, I'll just make the point. I've got Dr. Veitch with me, Catherine Morgan-Wicks, and Donna Adams, who'll each deal with aspects of the matters that we're going to talk about today. I do just want to say that I've been made aware of an incident at Hillcrest Primary School this morning, which involved a jumping castle, which unfortunately got away in high winds. People have been, as I understand it, seriously injured, and we currently have all of the relevant emergency services on site. I understand that there are serious injuries involved. As further information comes to hand, we will obviously provide it, but as this involves a primary school, Hillcrest Primary School, my thoughts are obviously with the people involved, but obviously the parents of the children that have been injured, and with the emergency services. But as we receive further information on what I understand is a very serious matter, we'll provide that as the day progresses. Now, and I think what I've just alluded to, I think will put some context around what we're going to be discussing in a moment. Obviously, our health and safety is the most important thing, and it's been a priority of this government as we have moved forward. And with our borders opening yesterday, it's more important than ever that we don't lose sight of that. Now, we've taken a cautious and sensible approach, and we've put in place strong measures at our borders over the last 22 months, and importantly as we move forward. We've taken all of the necessary measures that we can to ensure that we are ready for the reopening yesterday, and importantly for managing cases as they emerge. Now, as I've said on many occasions, COVID will come, and it arrived yesterday. I'm going to provide you with an overview, and Dr. Veitch will provide further information when he's able to in a moment. Yesterday morning, a man in his 20s arrived in Hobart from New South Wales on one of the early morning flights, Qantas flight QF1533. He was an approved traveller, meeting the necessary vaccination and pre-testing requirements, having received a negative COVID test prior to his departure as per the rules. After arrival, he was notified by New South Wales Health and informed that he was a close contact of a case in New South Wales. He went and took a test, and that result was returned last evening positive. He is now isolating at a residence and is being managed by COVID at home. It's understandable, though, that some people will be concerned, and I can understand that. However, what this demonstrates is that the system works. And we'll continue to follow the plan that we have laid out, and importantly the advice of public health. We followed that advice every step of the way, and we will continue to do that. We will not divert from that. Dr. Veitch, as I've said, will provide what further information he is able to regarding the flight exposure sites and close and casual contacts in a moment. But I'd make the point that this will be the first case, but not the last, that we will receive. And importantly, in terms of the way that we manage these sites, as you'd be aware, there'll be a dashboard going up daily each day to provide information as we move forward. I have purposefully held off on that dashboard until 11 a.m. this morning so that I could inform you myself of the circumstances yesterday. Now, I just want to touch on the reopening yesterday. I have to say, and I'd give a shout out to the media on this. I was very touched by the coverage that you ran last night in terms of the scenes at the airports, and I think if that provides any evidence at all of the reason why we need to continue to enable a moving forward, I think that the vision that we saw last night was proof positive of that. To see families reunited, in some cases after almost years apart, was very touching, and to be frank, I felt was real demonstration of the need to ensure that we do what we can as we move forward, both to keep Tasmanians safe, but to ensure that we continue to enable people to be reunited. Yesterday, more than 7,000 people were registered to travel to Tasmania. From all of the reports that I've received, our systems worked very well. The vast majority of people that arrived observed the rules, with just 2 people being cautioned after flying in without the necessary approvals. 1 person was returned back to Adelaide. The second person is in quarantine. The Deputy State Controller will provide further detail on processes at the border yesterday. Importantly, the throughput at our airports was, I think, very well managed. There were some delays, but I think it worked very smoothly. Now, in terms of other matters relating to our management of the pandemic, last night, Public Health obviously made some changes to the travel directions. They've been monitoring the situation closely in other states, and in response to the increase that we have seen, especially in New South Wales, and including from the Omicron variant, they've now added additional high-risk areas in New South Wales and Victoria. A total of 29 additional New South Wales local government areas were declared high risk last night. The area of Wollondilly has been downgraded, though, to low risk as part of that assessment. What this means is that the Greater Sydney area is now all high risk, in addition to Central Coast, Newcastle, and a number of LGAs that surround Newcastle. In Victoria, there has been a declaration of 3 new local government areas, Maroondah, Nillumbuk and Whitehorse, and this means that all of the Greater Melbourne area is now designated high risk, as well as Geelong. The full list of high risk areas is on the coronavirus website. Now, what this means, and I want to step through this carefully. Firstly, to those who have already arrived in Tasmania from these additional high-risk areas that have just been declared, you're simply asked to monitor yourself for symptoms, and if you have even the mildest of symptoms, isolate and get a test. Just follow the rules. And I want to be very clear on this. So anyone that's currently in the state who is already here, that should they have any symptoms at all, isolate and get a test. Now, for those that arrived before Sunday the 19th of December, you're asked to monitor yourself for symptoms, and likewise get a test. And if you have any symptoms, get tested and isolated until you get the result. Secondly, for those travellers, as I've said, that arrived before Sunday the 19th of December, who've already received approval, and there will be some people that will be arriving today that have already had approval, but reside or have been to one of those newly designated high-risk areas, again, just follow the rules. If you've got symptoms, get a test. Thirdly, any passenger with an already approved pass to enter from Sunday the 19th of December, and anyone who submits a new application from today onwards to enter from a high-risk area after the declaration was made last night, you'll be required to return a negative COVID test 72 hours before they depart for Tasmania, in line with the current rules that are in place for high-risk areas. And again, if travellers arrive without evidence of a negative test, they'll be required to quarantine until they can provide evidence of that negative test. And finally, for Tasmanian residents returning who've spent time in any of the new high-risk areas, which predominantly means the Greater Sydney area. That's the area that has largely been captured last night, but obviously Greater Melbourne is now included as well, but there's only a small number of LGAs that have been added. If you've been on a trip for 7 days or less, you must get a COVID test within 24 hours of returning to the state, but you don't need to isolate unless you have symptoms. That's in line with the current rules as they stand at the moment. Now, I think in terms of the changed rules, I think they will be easy to understand, they'll be simple. Importantly, if you're coming to Tasmania and you're booking in today and you'll be arriving here from Sunday the 19th, you must have a COVID test, pre-test before you come. If you've already got a pass and you are arriving before Sunday and you haven't got the time to have the 72-hour test, simply isolate if you have any symptoms and go and get a test. And I think if people continue to follow those rules, we'll manage our way through this sensibly. Now, importantly, in terms of vaccinations, as it stands today, 90.85% of Tasmanians over the age of 16 are fully vaccinated. I'd expect that that's going to rise to 91%, if not later today, certainly by tomorrow. 96.4% have had at least one dose. Very soon we'll reach the 90% of all Tasmanians aged over 12, as we said. We expect that by the 17th. At the moment, 89.44%, and that'll rise again today. Aged over 12 are fully vaccinated, and now 95.27% have had at least one dose. I want to remind parents that bookings are now open for children aged 5 to 11 to get their first dose of COVID-19 vaccine. Pleasingly, around 5,000 are already booked in for their first vaccination from the 10th of January, and I'd encourage parents to take those steps. Importantly, bookings are now open for people eligible for the 5-month booster shots. As we previously discussed, the time frame has been reduced from 6 months to 5. Boosters are available in state clinics, at participating GP and pharmacy clinics, and bookings are essential at the vaccination clinics. Again, Catherine Morgan-Wicks can provide some further detail there if necessary. Now, importantly, before I hand over to Dr. Veitch, it is understandable that some people will feel a level of apprehension in terms of the fact that we have a case. But that case is being managed, our systems have worked, and importantly, as we move forward, I would encourage Tasmanians, importantly, to simply do the right thing, continue to follow the rules, do the small things, socially distance. If you are indoors and you can't appropriately socially distance, wear a mask. And I want to thank the media today for wearing a mask in this room. Just simply do the sensible things as we move forward. As we see more cases arrive, obviously we will continue to manage them in the most appropriate and most sensible way, as we've done so right through this. I'll hand over to Dr. Veitch to say more.
Thank you, Premier, and good morning. I'll provide some more information about the case that was diagnosed yesterday and the public health response, and then I'd be happy to take any questions. So yesterday, at a bit before 8 p.m, I was advised by the Public Health Emergency Operations Centre, the team that does the contact tracing and initiates the interviews with cases, of a person who'd been diagnosed with coronavirus yesterday in a Tasmanian laboratory. This person was a male in their 20s. As you heard, they'd arrived in Tasmania on QF 1533 fairly early yesterday morning, after having met the testing and vaccination requirements that they needed to meet to travel and enter Tasmania. Shortly, or around the time of their arrival, they reported being alerted by New South Wales Health that they were a contact, and because they had been at a hospitality venue in Newcastle last weekend where there was significant transmission of coronavirus. Upon receiving that information, they travelled into the city. They picked up a car in town and travelled out to the showgrounds where they were tested. And that test was run yesterday afternoon and came back positive, and we were notified. Whether or not that's a case of Omicron, we won't know until further testing has been done, which will be through either tomorrow or Saturday. But in the meantime, we are managing this case as if they do have the Omicron strain. The contact tracing involves the following things. The taxi driver who took the case and their family member who travelled with them into the city has been identified and is in quarantine. The family member who travelled with this person is also in quarantine. The flight manifest, the list of all the people travelling on the flight, has been obtained. We have identified the people sitting in the same row as the case, and those 2 rows ahead of him and the 2 rows behind him as close contacts. Sorry, as close contacts, and those people are required to get a test at between days 3 and day 5. Actually, I'm sorry, I've just jumped ahead. I'll just restart that one. People on the plane. There were a total of 97 people on the plane. 19 of those people we have defined as close contacts. They are in the 2 rows before and behind the case and the same row as the case. They've all been contacted by SMS and they're currently being interviewed by and contacted by Public Health. The advice to them is that they are close contacts and they will be required to quarantine for 7 days. And they'll have a test at the start of their quarantine period and at the end of their quarantine period. If there are any people in that row who are not vaccinated, and that's probably restricted only to children, they'll be required as close contacts to quarantine for 14 days. The remaining people on the plane, so that's the remaining 78 people on the plane, are casual contacts. There's 78 of them, that's 97 minus 19, 78 casual contacts. And they're required to have a test on day 3 to 5 after they got off the plane, but they're not otherwise restricted other than being required to wear a mask for 14 days when they're in public. The airport has been defined as a low-risk exposure site for the time that the case was there, between 8:30 in the morning and 9 o'clock. That means that people who are at the airport at that time are asked to monitor for symptoms, and if they get any symptoms, to go and get tested. We'll also be sending SMS messages out to people who checked into the airport during that time. I think that's most of what I need to tell you about the case. I mentioned that we expect to get the test results for Omicron testing through in tomorrow or the next day, but we're managing this case cautiously. I think it does represent, as the Premier said, a situation where the system has worked. The person being a contact at an exposure site in New South Wales was obviously at much higher risk of having COVID than the average person coming in from Sydney or from New South Wales or from Victoria, but their exposure to members of the public was very limited in Tasmania, and it's my hope and expectation that this case is managed neatly without any establishment of community transmission.
How would a case of Omicron change public health's response to COVID? Would it change anything?
No, we're managing it as if it is a case of Omicron, yes.
And
so it doesn't change anything.
In terms of future restrictions or lockdowns, are they on the cards at any stage, particularly if we see large clusters of COVID arise?
This is a single case of what from the appearances, a well-contained case of coronavirus.
Yes, sorry, I just mean in the future.
We will monitor coronavirus cases occurring in Tasmania as the months pass, and we will look at the number of cases, the rate per capita we're seeing, and we'll pay particular attention to the severity of cases, and if there's more severe cases or cases that result in hospitalisation, that obviously raises concern. There are a number of things that we can do to actually manage COVID spread in Tasmania long before we get to lockdown stage. And most people in this room are demonstrating that right now. One of the things that we can all do as an important public health and social measure is to wear a mask when we're in indoor public spaces. That will reduce the chance that we catch Omicron or any form of coronavirus infection. It'll also reduce the likelihood that we spread it to other people. There are other measures such as restricting gatherings and reducing density in public places. Obviously, as part of returning to as normal a possible Tasmania as we can possibly manage, we want to avoid using those more intrusive public health and social measures, and it actually is a reason why it makes an even stronger case for us to get on board with mask wearing. And I see in this room and I see in the streets, people are quite quickly taking up masks, and that I think the experience of the mainland states that have had a lot of coronavirus and even the modelling that we've received do suggest that masks make a difference, and I think that I would certainly want to see people wearing masks pretty universally in indoor settings once we start to see cases of coronavirus in the community, and that will reduce the likelihood that we get into strife and need to use more restrictive measures.
Do we know yet if any children were put up as close contacts on the plane?
I don't know.
So that's something that's still being worked through?
We receive a flight manifest that tells us who's on the plane. It doesn't always give you the age of the person, so you don't know whether they're a child. But the SMS messages go out to families, and at this stage we're going to be trying to contact everybody who's a casual contact on the flight. We'll find out whether there are children in the family then.
New South Wales yesterday announced they're expecting quite high numbers of Omicron to emerge. If that does happen, is that likely to lead to you recommending stricter border measures with New South Wales?
We believe that the settings we have in place are appropriate based on the current risk. Our objective is to not prevent every single case of COVID coming into Tasmania from New South Wales, Newcastle or Queensland or Western Australia. It's to actually reduce the number of cases that come in. And for that reason, yesterday I provided advice to the Deputy State Controller that we should designate all of Sydney, the area up towards and including and around Newcastle, all of Melbourne and Geelong as high-risk areas, which will require people from all of those locations to get a test in the 3 days before they come here. The aim of that change was really threefold. Firstly, we want to reduce the risk of someone coming here by getting people who are already infected or incubating infection picked up by a test so they don't come. Secondly, we want to simplify the messaging so that it dealt with all of Sydney, all of Melbourne and a couple of other areas near those cities, so it's easier for people to understand when all of the LGAs are wrapped up. And thirdly, in making that declaration, I was keen to get ahead of perhaps the sort of increase in cases that you're talking about. And that's the location where those cases are likely to escalate most quickly and in the greatest numbers. So making that designation quite quickly and getting it in place. We put Newcastle on the list a couple of days ago, was aiming to reduce the likelihood to make sure that we had adequate measures in place to, at least for the time being, manage the increasing risk in those jurisdictions.
And we saw New South Wales yesterday as well change their definition of what a close contact is. Can you just outline, just for clarity, how Tasmania defines a close contact?
It's actually fairly similar to New South Wales in that we will define people as close contacts if they're household contacts, if they are people who have household-like contacts, so there's someone who has frequent face-to-face contact with a person. But we also use a bit of discretion. We have experienced public health nurses in our public health response team. They interview the cases, they tease out who they are in the closest contact with, and particularly in the case of Omicron, we'll be very cautious to make sure we don't leave people who could be close contacts out of requirements that protect Tasmania.
Just back to my earlier question about future restrictions, if we are to see a large outbreak of COVID, would you be ruling in or ruling out future lockdowns and potential recommendations for closing the borders again, additional mask wearing?
You've asked me a question which has got about 5 embedded what-ifs. So I'm sorry, I can't answer a kind of broad hypothetical question.
There's just a lot of uncertainty in the community, particularly around, would we be facing future lockdowns? Is that something that you could clarify if we did see an outbreak?
We will use we have a very good contact tracing team who managed magnificently last year in the very early days of the outbreak when they dealt with the northwestern outbreak with far less experience with COVID, far fewer staff, and far less in the way of technological supports that we now have to manage clusters of cases. So it would be my expectation that those very capable people would take contact tracing, would effectively conduct contact tracing around an emerging outbreak and aim to contain it.
You said 19 close contacts on the plane. How many all up, including, I don't know, family members or anything like that here?
There's 97 people on the passengers on the plane, is my understanding. I believe there's 78 who are not in the 2x2 rows before and behind the case. So there's 19 plus 78, 97. There's aircrew. I'm not sure of the number of the aircrew on the plane, but the airlines manage the contact tracing around those cases. There's the case, their family member, and a taxi driver at this stage.
What's your message to parents who may hear about this case and think, right, well, I'd better lock up my unvaccinated child away from the world now?
I think that if parents see this case, hear of this case, I hope it confirms their understanding that COVID can definitely come into Tasmania and that it can be capably managed by public health authorities in Tasmania. I hope it reminds the parents that they could have been the taxi driver or they could have been another passenger on the plane, and that the best thing that parents can do is get themselves vaccinated, their children who are eligible for vaccination vaccinated, and know that that's the best protection. We know that there is a small part of the population, the children under the age of 12 who are not yet eligible for vaccination. That's coming. They'll be able to get vaccine within the month, and I would certainly encourage them to make bookings now. And I think they can also take reassurance that the illness of coronavirus appears to be generally mild in young children, so they shouldn't be unduly concerned, but should just take pragmatic measures. If there's a cluster of cases in your family circle, then perhaps it's wise to avoid contact with people who you know are cases or contacts. And the other thing is, even though I've said that mask recommendations are principally focusing on people in public indoor settings, if you're having a modest-sized, COVID-safe family gathering and you've got vulnerable grandparents or other family members who are vulnerable, it's kind of sensible to make sure that nobody who's ill goes to your Christmas gatherings. Try and hold them outdoors where the environment is safer, and you might choose to wear masks within your family in those situations for that short time if you've got vulnerable people in there, particularly if there's community transmission in Tasmania at that stage.
And we'll go to Donna Adams.
Good morning, everyone. I'll just provide some updates in terms of the border processes from yesterday. I can advise that the border processes worked extremely well at all of our entry points across the state. We saw the majority of travellers using our new travel system, and we had 7,121 people actually arrive across the state, whether that be at the Spirit of Tasmania or at the airports. There was a high level of compliance. Travellers were ready to provide their evidence, whether that was proof of vaccination or their test result, and it took between 20 to 40 minutes to process each of those flights, especially those from a high-risk area took a little bit longer. Travellers were patient and they were cooperative, and I'd really like to thank our staff, the biosecurity staff, Tasmania Police, the health officials that were down there, and the airport staff for the way in which they responded to the travellers coming in, and they had a very well managed system which they made some slight changes based on the flow of passengers, and things worked particularly well. In terms of unauthorised travellers, I've got the up-to-date figures as of this morning. We've actually had 5 unauthorised travellers that have arrived in the state. 2 of those have been subject to an immediate turnaround, and we've had 3 international travellers that have been placed into hotel quarantine. As the Premier said, we've had 2 cautions that police have issued, and we've also fined 2 travellers for failing to wear a mask. One of those travellers, a 24-year-old woman from Victoria, was actually arrested for failing to provide her name and address and refusing to cooperate with police at the airport, Launceston Airport, and that particular female was actually bailed to appear in the Launceston Court of Petty Sessions on the 2nd of February. Generally speaking, yesterday went particularly well. The plans that had been put in place were effective, and the additional measures that we took to have biosecurity staff, in particular in Sydney and the Melbourne airports, providing travellers with that up-to-date information and the flyer to remind them what they needed when they arrive, made those travellers well prepared when they actually got off the plane, as they knew what evidence to provide and show the biosecurity staff.
What was it specifically about the 5 travellers that made them unauthorised? Were they unvaccinated, or did they just not go through the proper process?
2 travellers actually hadn't registered their travel. One of those travellers was unvaccinated, and he was a male from Adelaide. He was immediately turned around. The lady that actually hadn't completed the application, when she realised she'd come from a high-risk area and was required to have a test, she also chose to leave because she was actually only entering the state for 2 days. And the 3 that are actually being placed into hotel quarantine, they're actually international travellers. And I think that there is a lack of understanding from those that travel internationally about, they think that the Australian borders are open, and that applies to every state. So we'll continue to look at our messaging to make sure that the website's really clear for international travellers, so that they understand that there are certain requirements to come into Tasmania.
Were those international travellers, were they international students?
I don't have the details of their age. No, sorry, I don't have that detail.
So aside from the woman that got arrested, none of these were deliberate flouting of the rules?
No, there was no one that entered the state and tried to obviously breach our system.
I don't know if you're able to, but are you able to provide an update on the police response, or if police are responding to this incident in Devonport at the primary school?
Tasmania Police has the lead role in that particular response. That's an unfolding critical incident. There will be further updates that will be provided throughout the day in relation to that, but that incident has actually been responded to as we speak, so it would be inappropriate to speculate on what's actually occurred there.
Are you able to give us an idea of what kind of resources have been sent?
Tasmania Police has a number of resources, obviously, to help the Hillcrest Primary School staff in responding, but there are also a number of other emergency services, whether that be the ambulance also attending, and the police helicopter is also there.
And you're advising members of the public to stay well away from that area?
Whilst we are responding to the critical incident, it's important that public do allow the emergency service workers to do their job, so we would ask that people not actually congregate around the school.
Are you impressed, of thousands of people that entered the state yesterday, only a very small handful of people actually entered the state in an unauthorised way?
We were particularly happy with how things went. I personally spent an hour and a half down at the airport and actually spoke to travellers to try and get some direct feedback from them about how they found the system and the information that we had on our website. I was really encouraged with that feedback. People found that it was very clear, that they could follow the instructions and the guidelines, and that additional strategy of having some workers at the Melbourne and Sydney airport providing the flyer and the information, so that when a traveller actually disembarked from an aircraft, they knew exactly what they had to do.
Okay, Catherine Morgan.
Good morning, everyone. I'll just provide a brief update in relation to our COVID at Home program and vaccination. The Department of Health has been preparing for nearly 20 months to respond to our first COVID cases in the community. And the COVID at Home program is now operational, and we have our first case in the program. And the program provides a remote monitoring and online support program to deliver safe and effective care to a COVID positive individual within their home. Now, the program is available to people who have tested positive to COVID-19 and are suitable for care in the home environment. For COVID positive individuals, a clinical assessment is undertaken by our healthcare team to determine the right level of care for them. And this assessment will determine if it is safe for an individual to stay at home under the COVID at Home program, or whether they need a higher level of care and support in their COVID recovery, either in a community case management facility or in a hospital. And caring for individuals with COVID-19 in their homes allows for the provision of appropriate care, minimises the impact on our healthcare system, and frees up hospital beds for patients with moderate or severe illnesses. And it's really important to note that with Tasmania's very high vaccination rates, that the vast majority of our COVID positive cases will be able to safely recover in their homes, and our COVID at Home program will support you to do just that. Now, the Premier has already noted Tasmania's incredibly high vaccination rates, but our key messages on vaccination to Tasmanians today: if you have not received a first dose of the vaccine, our borders are open and you need to get vaccinated to protect yourself, your family and the community. If you still need your second dose, please finish the job and give yourself that maximum protection. Book in now for your booster if you have had your second dose more than 5 months ago and you are aged 18 plus. We have thousands of booster appointments available. You can book online or ring the Public Health Hotline or go to your GP or participating community pharmacy. If you are a parent, please book in your 5 to 11-year-old. We now have over 5,000 bookings for our 5 to 11-year-olds in state clinics already in for January. But let's lift this number up and get all of our 45,000 children aged 5 to 11 vaccinated before school returns. And for the parents of the 6,000 12 to 15s that are still yet to receive their first dose, please do not delay this any further. Take them to the GP, take them to your local pharmacy, or book them in today for our state clinics.
I think the modelling that we had, I think from the Kirby Institute, that was based on Delta. Is there updated modelling coming for looking at how Omicron might affect Tasmania's health system?
So we are closely following the Omicron variant as cases are occurring in the mainland jurisdictions, and we are looking at both case numbers, but critically also the level of hospitalisations and ICU rates. And you'll note from today that the Department of Health has posted on our social media page, and it will be available on the website, a tile which is recording all of our active cases, the numbers that are in our COVID at Home program, because that is our expectation, that, you know, with a highly vaccinated population, that the majority of our cases will be able to recover safely at home, and we can support you with the COVID at Home program.
But we're not commissioning updated modelling.
So we are closely watching it. Our modelling is actually live in terms of the Kirby Institute. We have a fully built and live model that we are able to access, and our health officials have been, you know, feeding particular parameters into that model to help us prepare for our borders to reopen.
Some pharmacists and GPs are saying they can't keep up with demand for children's shots and also the booster shots. They want to see some more state-run clinics open. Would that be on the cards? So
we have now 45,000 bookings that are going to be available in our state clinics for our 5 to 11 population. So certainly we are responding very strongly in our state clinics for our 5 to 11s to be vaccinated. We've opened up over 10,000 booster doses in terms of spots in our clinics to be available, and we've got several thousand that are available, you know, as we speak today. So please do hop online and book in for that booster, book your children in, and don't forget our 12 to 15s. So our 12 to 15s are currently sitting with a vaccination rate around 76%. It means that we still have 6,000 that are sitting in that 12 to 15 age bracket. You know, schools are finishing up now. Please do take your child and get them vaccinated.
Other parts of the world have suggested providing booster vaccines before 4 months. Have you had any further discussions around potentially bringing that forward?
So certainly our Dr Veach participates in AHPPC every single day in terms of monitoring what is recommended from either the TGA or from ATAGI, which is the technical group, a national group that makes recommendations on the timing of doses, and they're the ones that actually brought forward from 6 months to the 5 months over the last weekend. So we continue on a daily basis to monitor on a national level.
Questions for the Premier?
Thanks, Kath.
Romeo, given the case numbers that New South Wales says that they're expecting over the next month or so, do you stand by the decision to reopen the borders as being the right one for Tasmania?
Well, we've reopened our borders with a plan, and that plan is to ensure that we manage those high-risk areas on the mainland. And as I've said this morning, and Public Health last night acted in terms of ensuring that where there is greater spread, higher risk, that we put in place the appropriate measures. And for anybody coming in from Greater Sydney now, they'll need to have that test 72 hours before they arrive.
Was yesterday's date a bit preemptive? The Greens said that the border reopening date yesterday was more of a political decision rather than one based on health advice. What do you say to that?
Look, in terms of the border opening date, we set a target, and that was to have one of the highest levels of vaccination in the country, and we've achieved that. Now, other states have opened at below 80%, some at 79%. In Tasmania's case, we diverted from the national plan, which was to move through different stages, 70%, then 80% and reopen. We didn't do that. We took the view that we should have a higher level of vaccination. That's exactly what I've done. And in terms of the date, as you're well aware, we're above 90% for over 16s. We're just on 90% for the over 12s. So we've achieved our objectives.
The Greens also said we should look at closing the borders if we do see a COVID outbreak. Is that something that you would consider?
Look, I'll take my advice in terms of COVID from Dr Veach and Public Health, not the Greens.
But you must have a plan under what circumstances would you close the border?
Well, as I've said, in terms of the advice I take, that will come from Public Health. It is fair to say that in terms of the measures that we have in place, I feel quite comfortable with them. Testing people to ensure that they don't have COVID before they come, ensuring that they are fully vaccinated. Importantly, we know that with the health services around the country, as was demonstrated yesterday, where close contacts are identified, they will be notified by their own health service, and as we saw yesterday, then asked to have a test, and then we can act from there. So in terms of where we stand at the moment, our plan remains the plan moving forward. I will make the point though, I think in terms of New South Wales, that it is a little concerning. They seem to have backed off with a number of their measures within that state, but again, the decisions in terms of New South Wales are a matter for their Premier. How we manage Tasmania is a matter for me.
So have there been discussions about, what circumstances you would close the border?
Again, our plan is the plan. We're in a very strong position, and until circumstances change or until I receive advice that we should change, we'll continue to moving forward with the plan.
And the New South Wales Premier and their public health representatives seem to be on different footings at the moment. Are you and Mark Veach well and truly on the same page?
Look, we have been on the same page since day one, and we will remain on the same page. But that's not a reflection on what's occurring in New South Wales. Look, how they manage themselves is a matter for them. But obviously, how we manage Tasmania is a matter for myself and the other senior people within public health, but also the State Control Centre and our Department of Health. But importantly, we put in place measures, and I want to say to Tasmanians, I can understand if you feel a little anxious, but we have always said and that we will receive a case. That has always been understood. Now, we have a case, we have one, and it's been well managed. The plan has worked, and we'll continue to work that plan.
That decision to reopen, were there any questions about that from Public Health given Omicron?
Look, in terms of the plan, that was fully supported by Public Health. In terms of the national plan, we diverted from that. The national plan, which was supported by National Cabinet and obviously based on initial AHPPC advice, we took a step away from that. We were more cautious. We always have been and we always will be. And that's why, as we reopened yesterday with one of the highest vaccination rates in the country, but also in the world.
So public health is that reopening plan every step of the way.
Absolutely.
Thanks all.